Hello, everyone, and welcome to the Generations United webinar on the Family First Prevention Services Act, implications for Grandfamilies. Before we get started, I'm just going to go into a few little housekeeping details. So to hear the presentation, you can listen through your speakers, or you can call in on your phone using the number displayed on the screen and the passcode. We'll have a Q&A session at the end of the broadcast, but you can send your questions now at any time, and please send those via the chat or the questions box, because we won't be able to let people speak on their phones. I think I'm more responsive to the presentation. If you, for whatever reason, miss things, or when I come back and re-listen to the recording or share it with others, the slides and the recording of the webinar will be available on the grandfamilies.org website later this week, and all registrants will also receive an email with a link to the recording. So with that, I will turn it over to Jaia Lent with Generations United to continue through the rest of the webinar.
Thank you, Adam. I'm Jaia Lent, the Deputy Executive Director at Generations United, and I'll be co-presenting today with Ana Beltran, Special Advisor to Generations United and our National Center on Grandfamilies, and Ana will introduce herself when she begins later in this presentation. So thank you. So for today's agenda, a little bit about what to expect, as well as what not to expect. We are going to open the program with some context for the Family First Prevention Services Act. Then we're going to hone in on three pieces of particular relevance to grandfamilies or kinship families. And so we will do a special focus on the prevention services piece of the Act, the piece about kinship navigators, and the piece related to model family foster care licensing standards. Then we will follow on with a broad overview of other grandfamilies related provisions in the Act, then talk about some of the next steps and opportunities for you as a person who is impacted by this change. And then finally, we'll talk about other resources that you can go to for more information, and then have an opportunity for questions. All right, so then what not to expect in this webinar. What we won't be able to do, since we have limited time, is go through the details of the entire bill. So we are certainly focusing in on the grandfamilies provisions. Even with that, to a certain extent, we're doing an overview. There are a lot of details in this legislation, but we will be honing in on those grandfamilies provisions. We also won't be getting into a lot of state-specific information. Certainly states will make different decisions about what to pick up from this bill and how it will look in terms of implementation. So we won't have a lot of state-specific information. And then finally, unfortunately, we're not going to have all of the answers, even about the kinship or grandfamilies provisions. Implementation of legislation is a complex process. It often starts with a lot of questions. But part of what we want to do is give you an overview and a context to start getting at what some of those questions are related to implementation and interpretation. And we'll be collecting that information. And the good news is that there is more to come. So stay tuned. As we get that information, we will do our best to be responsive to those questions that come up. So we're going to start with the legislative context. So it's important to recognize that the Family First Prevention Services Act was a piece of legislation in the making for several years and had lots of input from a variety of stakeholders. One of the early markers of this foundation for this legislation was a bill introduced by Senator Wyden called the Family Stability and Kinship Care Act. And that legislation in many ways was sort of a foundation for the prevention services piece of the legislation. Then, also that year, Senators Hatch and Wyden, who are the chairman and ranking member of the Senate Finance Committee, which has jurisdiction over this legislation, held a hearing called A Way Back Home that looked at alternatives to congregate care. That was also a real foundational piece looking at the issues that are addressed in the Family First Act. Following on that, in 2016, the Family First Prevention Service Act was introduced, and it really represented a bipartisan compromise that looked both at the issues related to prevention services in addition to ways to reduce over-reliance on congregate care. And it also was certainly a compromise in the fact that the amount of services and supports originally envisioned in Senator Wyden's piece, for example, were reduced as there was an effort to make it a bill that was also paid for. So it reflects changes to the the original legislation that was introduced in 2015, certainly. Also want to recognize that after it was introduced, we heard from youth, caregivers, birth parents who voiced their support for the legislation, and then there was a support letter from hundreds of organizations supporting the legislation as well. Then also in 2016, the House actually passed the legislation. Then in the Senate, there was an attempt to move the legislation by unanimous consent, but it was blocked by a few senators from passing that way. Often, it's important to recognize that child welfare legislation often moves by unanimous consent, and that's a way that legislation can pass when essentially all of the senators or the members of Congress agree for it to move. It's unanimous. So it did not move that way, but then later in that year, the legislation was added to another large bill called the 21st Century Cures Act. However, it was removed then just before that piece of legislation passed due to some opposition, in significant part from a group of congregate care providers that were concerned about some of the congregate care provisions, which reduced funding, which we'll talk about a little bit more later in this session. Then 2017, it was quieter around Family First as we had a new Congress and a new administration. And then in 2018, the legislation was included in the Bipartisan Budget Act. And I think that was really a surprise to many advocates that it was included, and then was signed into law when the Bipartisan Budget Act was signed into law early in the morning on February 9th as part of that legislation to keep the government running. And for those that really are interested in looking at the details of the bill, it is included in the Bipartisan Budget Act. You can find it at congress.gov and do a search for HR 1892, and it's also, I believe, linked from this slide. So themes in the bill, in the law. There were 4 themes that I think really sort of are umbrella to what we see in the legislation. One theme is prevention. It really recognizes that we want to be investing as a child welfare system in prevention, whereas previously the majority of federal child welfare money was really available only after a child enters foster care. And in fact, for every $7 that the federal government invests in child welfare, only one of those were invested in prevention. It also focuses on the theme that children do best in families, that every child deserves a family, and that there's recognition that there is over-reliance on congregate care settings for children, where children do best in families. So when congregate care is made available for children, that in terms of a federal investment, congregate care should only be for short-term, treatment-oriented reasons, and it also does a number of things to make sure that it's high quality. And then finally, it says that federal investments are going to really focus on evidence-based programs, so programs that have proven approaches to helping children and families. Those are the themes. So now we're going to dig into those 3 pieces that I emphasized in today's agenda, our focus areas. And those are particularly relevant for KIN. The first is prevention services and programs. So I'm going to talk about what it is and then who it affects and do sort of the who, what, when, why, where of prevention services. So prevention services are federal funds that can flow to states to provide up to 12 months of services to prevent children from entering or re-entering foster care. So specifically, who does that affect? It affects babies, children, youth, birth parents, and kinship caregivers that are either providing temporary or permanent care for children. And those children need to be identified as candidates for foster care. So when we talk about candidates, we're talking about children who are identified as being at imminent risk of entering foster care, but that they can stay safely either with parents or with kinship caregivers if those parents and or kinship caregivers have prevention supportive services for the family. It also does include children who are adopted or have guardianship, but that adoption or guardianship is at risk of disruption or dissolution. So in a sense, these are also post-permanency services that are available to children that are at imminent risk of re-entering foster care. And it's also important to recognize that families, children of families, can receive these prevention supports more than once if the child at another time later in their life is again identified as being a candidate or being at imminent risk of re-entering foster care. And then finally, a really exciting and important provision is that children and families that are eligible for prevention services are eligible without regard to whether or not they would be eligible for federal foster care maintenance payments. And that refers back to what child welfare sort of wonks in the field would understand is referred to as the look-back provision, which means that federal money is only actually available for children who enter foster care who meet certain eligible requirements related to the income of the home from which they are removed. So it's sort of a complex piece, but that complex eligibility requirement is not an issue for prevention services. So if a child meets the other requirements, they will meet this. They will meet the federal requirement to get reimbursement to the state for the services they receive. So that's the who. Next, what? What are these prevention services? So the prevention services really fall into three different categories. One is mental health. The other is substance use prevention and treatment services. And then the last is in-home parent skill-based programs. And specifically, it says that it's including parenting skills training, parent education, and individual and family counseling. Now it says parent, but that would be inclusive of kinship caregivers being eligible to receive those services as well. The prevention services also need to be trauma-informed, meaning that those that are providing the services need to be knowledgeable about the impact of trauma. So, it's most important that we recognize that when they're providing services that they're not making things worse, which there's a history of providers not being familiar with trauma. It's important that you do to provide the best supportive services for the family. And then finally, the big, perhaps most complex part of this provision is that the programs need to be evidence-based. And the law describes three categories of evidence-based services: promising, supported, and well-supported. Now, the state, to get federal reimbursement, the state that uses these prevention services needs to make sure that at least 50% of the funds that they're expending on prevention services are being expended towards those prevention services that fall into the well-supported category. And I'll talk about what each of those mean in a minute. If they do that, they can get 50% federal reimbursement for the funds that they expend for prevention services until 2026. And then after September 30th, 2026, that reimbursement rate goes up to the FMAP rate, which is the Federal Medical Assistance Percentage rate that states get. So that amount goes up after 2026. So let's talk a little bit more about evidence-based programs and what evidence-based means. So this first piece is referring to any type of evidence-based program that falls into those three categories. In order to qualify for evidence-based, the program must have a book or manual about it. In addition to that, there must be no evidence of harm for all of the bulk of the research that's been performed on the program must show, well, all evidence must show that there's no evidence of harm. In addition to that, the overall weight of the studies actually need to show benefit. So that's for any evidence-based program. Next, we'll walk through each category of evidence-based. The first one is promising. So to be a promising program, in addition to those three pieces above, programs must show that they are superior to whatever their comparison group is. Superior to the comparison group. They must also have an independent review that says that the program is well designed and well executed. And they must have some form of a control group. And that control group could be an untreated group of individuals, a group of individuals who's waitlisted, or who are receiving a placebo. So that's promising. The next category is supported. Again, with supported, they need to show they're superior to a comparison. They need to have an independent review that shows that it's well executed. And then in addition to that, they need to have a rigorous randomized control study or a rigorous quasi-experimental research design. It also needs to be carried out in the usual care or practice setting. And the research of the program has to show that the impact of that prevention service, the positive impact, is sustained for at least 6 months beyond treatment. And then finally, the highest standard of evidence-based is the well-supported category. And essentially, that well-supported category is the same as the supported category, but additionally, it needs to have showed a sustained positive impact for 12 months beyond the end of treatment. So those are evidence-based. Next, the when, how, and where. So when? This coming October 2018, the legislation calls for the Department of Health and Human Services to release guidance and a list of pre-approved prevention services. So they will be putting together a list of services that qualify for states that want to offer them, that qualify for federal reimbursement. That doesn't mean that that is exclusively the only list of services that will qualify. States that have identified other evidence-based programs can plan to use those dollars and put in a request for reimbursement, but this will be the pre-approved list of services that qualify. That's this October. Then beginning October 2019, the funds actually become available for states to be able to draw down for reimbursement. So how do they do that? In order to provide the prevention services, states will need to include in their state plans to the federal government that they plan to offer these prevention services. They will have to detail what services and their approach and plans for providing them in their state plans. There's a great deal of information about what needs to be included in their state plans in the legislation. I think it would be a topic for a whole other webinar because it's very detailed, but just recognize that they have to detail how those services are provided. I also want to point out that the legislation has a whole series of provisions related to congregate care. And as I mentioned, Ana will talk a little bit more about this, but it does actually reduce funding for sustained congregate care and ups quality standards for congregate care providers. So eventually all states will need to make those changes to comply with the legislation, but there is an option for states to delay that requirement for 2 years if they opt to do that. Those states that delay that requirement cannot start the drawing down money for prevention services until they start also implementing the congregate care provisions. So in terms of how states can start offering the prevention, they can include it in their state plans, but they also can only begin the prevention services when they are also beginning to implement the congregate care provisions. And then finally, on a real concrete sort of case level, how do children and families get those services once they have been identified at imminent risk or as candidates of foster care? Then the family and the agency will work together on putting together a prevention plan that outlines the services and programs for the prevention services. Once they have that plan in place, then they will begin to be able to access those prevention services. And finally, where is this legislation going to happen? It's available to those states that include in their state plans a plan to do the prevention services, and to localities. So while with some legislation it's required that a certain service is provided across the state, our understanding is with this particular legislation, we certainly hope that prevention services will be available across the state, but if a state elects to offer prevention services, it could be that they start in one locality of the state before they're available across the state. So they could be available in localities. In addition to that, tribes who have approved Title IV-E agreements with the state also could provide prevention services. And there are some allowances when it comes to those evidence-based requirements to make sure that those services that are provided allow for cultural adaptations as appropriate. In addition to that, we want to highlight one other piece related to the interaction between prevention services and licensed foster care for relatives. So I think really due to an oversight when the initial legislation was drafted, there was a piece where the prevention services, receiving prevention services, could have negatively impacted eligibility for relatives who later determined that it would be best for the child to come into foster care and for them to be licensed as foster parents. So the Family First Act added this provision that makes it clear now that if at any point a child or kin family that is receiving those prevention services, if at any point during those 12 months it's determined that the child should come into foster care and the relative should become a licensed foster parent, that child, that relative family would still be eligible for federal reimbursement for the foster care payment. So that clarification was important and included. So that's the prevention services. Next up is Kinship Navigator programs. So another exciting new piece of Family First is the availability of federal funds for Kinship Navigator programs. And when we talk about Kinship Navigator programs, we're talking about programs that provide information and referrals to services for kinship families. The legislation actually specifically refers to requirements that were for kinship navigators that were outlined in the Fostering Connections to Success and Increasing Adoptions Act of 2008. So if you're interested in those details, I would refer you back to that legislation. So who qualifies for receiving Kinship Navigator services? It would be kinship families regardless, again, of their eligibility for federal foster care payments. So again, as I mentioned before, it doesn't matter whether they would qualify for federal reimbursement for foster care. They can qualify for Kinship Navigator programs. In addition to that, it doesn't matter if they are child welfare involved. This is really an opportunity for information and referral for the full group of kinship families that need support. In terms of the specifics of those Navigator programs, beyond referencing the Fostering Connections Act, the unique piece here is that the programs also would need to fall into one of the evidence-based standards, so either promising, supported, or well-supported. But all of the programs could fall in the promising category. They can fall into any of those three evidence-based categories. And when? This is one of the earlier pieces that goes into effect in this legislation. States can actually start getting reimbursed for Kinship Navigator programs as early as this October 2018, if they meet the requirements. And where? Again, they can go to states. The states can provide those services via localities, and also any tribes that have agreements with the states. similar to the prevention services. And then finally, how? So certainly the public agency could provide kinship navigation. They could also have a relationship with a private provider that has a contract with the federal agency. And then what is the reimbursement rate? The federal reimbursement rate is up to 50% of the state's expenditures on evidence-based kinship navigator programs. So in terms of action steps, what comes next? We do encourage you to share any evidence-based programs for kinship families that you are aware of. Certainly there is an active effort by advocates working on implementation of this legislation, and from HHS, who needs to be putting together a list of pre-approved programs. We want to make sure that there is a strong list of pre-approved kinship programs available for them to include in their list. So please share them. You're welcome to send them to us here at Generations United. If you have a program that you know is a good program, but unfortunately have not had the resources to evaluate that program, we hope that you will be exploring that now with a goal of ultimately meeting that well-supported standard, certainly one of the evidence-based standards, so that ultimately your program will be eligible for federal reimbursement. And then finally, really to urge your state to pick up the opportunity to provide prevention services. Again, states need to include this in their state plans to offer the prevention services. So we want to be educating our states about this opportunity. Okay, and I'm going to turn it over next to Ana Beltran, who's going to talk about licensing standards.
Thank you so much, Jaia and Adam. So as you can see, the Family First Prevention Services Act does a lot for kinship families. We're very excited about it. And one of the other ways they're trying to help kinship families is by improving licensing standards, specifically for what they called out relative foster homes. So why are they doing this? Because we've known that the state licensing standards, and that's where these licensing standards are created for family foster homes, are create all kinds of barriers for kinship families. So this is a way to have the feds are asking the states to look at these standards, which is what they've always asked them to do, but now they're going to provide them with a little more help and a little more guidance by pointing to a model. So by this October, HHS is supposed to identify a model that the states can use to compare their standards to. And then by next April, each state's supposed to report back to HHS on that model and that comparison. And they're also supposed to do a number of other things looking at their waivers. So under federal law, states are allowed to waive non-safety licensing standards for relatives. And those, the non-safety part, the safety part, is all defined by the states. So the feds don't really say what is or is not safety. So that also is up to the states. The states have a great deal of flexibility here. And from what our experience is, they really would like some guidance on what other states are doing and how better to license relatives. Because although a third of the foster care system is made up of relatives caring for children, many of those relatives are not licensed and are not receiving the foster care maintenance payments or the services or the support of the system, but they are subject to the rules and regulations. But the children are not necessarily having any kind of support to have their needs met through that system that they're a part of. So what does federal law say about these licensing standards? The feds right now, this is on this page is really all the feds currently say about state licensing standards. So states have to have a state authority that does them. They have broad flexibility as long as those standards are reasonably in accord with recommended standards of national organizations. And that's the piece where where having HHS identify a model is relevant to, because as of now, the feds don't point to recommended standards of national organizations. So states don't really know what that is, right? What that is there. So that's where the feds are now providing some clarity around that. And you'll see that it can waive non-safety standards and where that comes from, and that they have to periodically review their licensing standards. And then the only other really requirement from the feds is that they have to adhere to the Adam Walsh Act and conduct criminal background checks and child abuse registry checks on relatives and non-relatives seeking to become licensed foster parents. But so you know, most states, or at least half, go well beyond Adam Walsh Act and require many more things of applicants trying to become foster parents. And that in and of itself can create quite a few barriers for relatives. So what is the model HHS is going to point to? Well, we have had this model out for a few years now, and it was done in partnership with the National Association for Regulatory Administration. They basically are the nation's licensors. It's a voluntary organization, but they really are the experts. And so we at Generations United and the American Bar Association Center on Children and Law, in partnership with Annie E. Casey Foundation, went through a multi-year process to look at all the state licensing standards, to identify what the barriers were, what good language was, and really create this very thoughtful, common sense model. And we are hoping and working towards HHS pointing towards this model, because it is really the only comprehensive model for family foster home licensing standards. So HHS's only other choice would be to create their own new model. But this model, we are very confident about. Some states have been crosswalking it, have been lifting parts of it. So we're seeing some success with it, and we do hope that HHS points to it as the model. And will then be poised to help you and help anyone who needs help comparing their standards to the model and doing all the other things required by next April. So this package is available free. It's available on those two websites, and it has all those elements in it, including that crosswalk tool, which will allow states to report back to HHS by using that tool and seeing how their state standards differ or are similar. So what are the model standards? Well, we use that model language that I mentioned from the state. So a lot of the standards you may recognize because, for example, we borrowed language from Illinois about how to assess crimes that aren't barriers under Adam Walsh. So there's a lot of language in there borrowed from states that we collectively thought was excellent language. We also borrowed some language from accreditation agencies like the Child Welfare League of America and the Council on Accreditation. And they have standards, but they don't have standards that are as comprehensive about just the process to become licensed. They have standards that concern post-placement that our standards don't. But right now, what is at issue in this law and what the feds are asking states to look at and what are creating barriers for relatives and non-relatives are these state licensing standards that have to do with licensing pre-placement of a child. And that's what our model covers, and that's all our model covers. These agencies tend to cover a number of other things, but aren't as comprehensive for that piece, that this issue here. So what does our model do? Well, we feel it really fulfills the public policy intent, which is behind licensing standards, which is to ensure that children are safe and appropriate homes. That really everything has to do with safety. Nothing is non-safety because it's all very essential and it's all very common sense. And gone are standards like you can't have a Rottweiler, or you have to own a car, or you have to have so much square footage. Those kinds of standards that have more to do with wealth and socioeconomic bias and perhaps litigation in the states are gone, and they're replaced with common sense safety standards. So, and the best part about the model standards from the paperwork perspective is that no waivers or variances are needed, because we really do feel that all the standards are necessary. There is language in there that provides licensors with flexibility to look at sibling groups, to increase capacity standards to keep siblings together. There is language in there that provides some necessary wiggle room to look at the case at hand, but waivers and variances in that whole process is not necessary. So that would definitely streamline that reporting requirement by April 1st if the state adopts our model. Categories covered, you'll see it's really everything. So our standards just cover everything that concerns licensing a foster parent. And the assurances section, which I bolded there, is really the only thing that concerns post-placement of the child in the home. And those are things that we feel could be deal breakers for applicants, kin or non-kin. Things like you can't smoke in the house, what kinds of pools, safety standards you have to have, that your guns have to be locked. Those kinds of things that might be deal breakers for some people, and we feel it's important that they know about those things up front. So what are the action steps? Well, as you see, under this law, by April 1st of next year, you have to report as a state on these, your standards and your waivers. And so we, recommend that you establish a work group, and the earlier you start, the better. You can start looking at your standards and seeing what are really causing these barriers. And, perhaps convening caregivers and asking them, why aren't you licensed? What is the barrier? Because there's a lot of that notion out there that, oh, relatives don't want to be licensed. But we find that when we talk to people, it's often because they weren't presented with it as a real option. They weren't explained to it what it was. So a lot of these relatives, like I mentioned earlier, are subject to the rules and regulations of the foster care system, but then don't get the services and support. So, so really identifying what those barriers are. And as I say, you can start early, and we're here to help if you need any help with that. And looking at your waiver practices too, you can start getting started on that. We have a WikiHow for Kinship Foster Care that we developed with the American Bar Association, Center on Children and Law, and Child Focus, Inc. And it is basically a very short document on key steps that child welfare agencies can take to be a kin first agency. And as part of that short document, there's an element about licensing, about waivers, and there are tools from states in there that you can look to for kind of promising practices and what may work in your jurisdiction. Some things that we like are that, the forms are there. So the waiver and the variance process is very transparent. Every caseworker knows how to get it, who to go to get it. There's a clear form. There's a clear hierarchy of where to get approval. Sometimes there are designated kinship liaisons that can help relatives through that process and through the waiver process. And just to backtrack a little, variances are, so waivers are basically you don't have to follow this standard. A variance is another way to meet that standard. So for example, if your home doesn't have potable water, a variance could be you've got to have bottled water. So that's just it's just another way to get to modify the standard. But wanted to explain that. So that's the licensing standards bit. And as I say, because we have been doing this for a number of years, we looked at all the 50 state licensing standards. We've created these models. We're poised to help you if you need any help in that element of this required law, of this law and its requirements rather. I just want to highlight, because this is such a dense law. There's so many great provisions, and we are just focusing on the kinship thing, the kinship pieces. But I do want to highlight a few things here that are aside from what Jaia talked about, the prevention pieces, the kinship navigator, the licensing, and these are a few other kind of key provisions. I'm just going to give you a real brief overview. So as Jaia mentioned, there's the whole piece, which is huge, about how federal funds are not going to be allowed to be used for inappropriate group placements. So that is a very large and important piece. There are certain placements that are permissible and certain requirements that have to be met. And there are one of those placements that are okay in a group-like setting is this Qualified Residential Treatment Program. And there are a number of elements around that and what it takes to be a QRTP. But one of them that's really important for kinship is that the importance of family connections is really elevated in this provision. Kin have to be, the program has to facilitate outreach to siblings and victim kin and of course family, blood relatives. They must be part of the treatment, including family support for at least 6 months post-discharge. And as part of the assessment of whether the QRTP is appropriate, the placement preferences of the family have to be considered. If they're not considered or followed, that has to be fully documented, and they have to be placed with siblings unless it's not in their best interest. So really a lot of important pieces around maintaining family connections. A second piece is expediting the interstate placement of children in foster care. So requiring states to all use an electronic interstate case processing system in the next 10 years by 2027, I believe. We'll get to that timeline in a minute. There's some funding available under this piece for states that want to enhance their case processing system or don't have one yet. And there's a whole process that the law lays out of how to ask for that funding and that support. And they're going to give priority to those states that don't have a system yet. The third thing is it extends funding for these 2 critical support programs for 5 years as of now. So that is good. It extends services through the Chafee program. So it's going now to age 23 for financial, housing, counseling, employment, etc. Now it's only between ages 18 and 21. Now this extension is only available to states that have taken the option to extend foster care to 21, or that HHS has determined is providing similar services as if they had taken that option to extend to 21. And then it extends to age 26 for education and training vouchers. Now it's only available to age 23. So some important changes there. And then finally, it reauthorizes for 5 years the Adoption and Legal Guardianship Incentive Payment Program. And that's as of now as well. It was set to expire in 2016. So it actually goes, as of 2016 forward. And what this is it awards payments, incentives to the states if they increase their permanency numbers to adoption and legal guardianship. So these are, it's such a huge bill. I encourage you all to look at Children's Defense Fund resources, which we'll give you at the end, which has some really, a lot more detail along these lines. Timeline. So I think did I lose my ability? No, there we go. So, and I went too fast. The timeline. So this is just an abbreviated timeline for those provisions that we talked about today. There's, of course, a much bigger timeline, too, with a lot more elements of this whole huge act. And Children's Defense Fund has a big timeline for all of that. But so that you get an idea of what the kinship provisions are. As of now, like I mentioned, those 2 service programs, the Stephanie Tubbs Jones and the Safe and Stable Families are extended. Extended ages for the Chafee program, and it reauthorized those incentives for permanency, like I mentioned. As of October of this year, HHS is supposed to identify that model for licensing standards. It's, like Jaia mentioned, supposed to provide guidance on prevention and a list of pre-approved programs, and start providing federal reimbursement for certain Kinship Navigator programs, as Jaia talked about. Then April of next year, each state's supposed to report back to HHS about their licensing standards and about the use of waivers and all those elements that I listed on that slide. Then October of next year, states can start using federal funds for prevention services, and states will no longer be allowed to use federal funds for inappropriate group placements, although they can ask for 2 more years, like Jaia mentioned. And then finally on this timeline in 2027, so just a little under 10 years from now, all states must start using those electronic interstate case processing systems. Finally, what is next? So next is my ability to flip that slide, there we go, is for continued updates on what's happening, what we're developing, what questions are being answered, what HHS is doing. Sign up for our Generations This Week and quarterly Grand Voice newsletter. These are free resources. You just go to gu.org, the homepage, and I think it's up on the right-hand side. You'll see sign up for alerts. You click on that and fill out a form, and then you will get those resources into your inbox. Raising your voices. So as Jaia highlighted, some of these things are optional. So really letting your state know that you want them to start doing these things. You want them to start taking prevention services, making them aware, letting them know that you're a kinship resource to them. You know, that if they don't know much about how a Kinship Navigator program works, perhaps you're a Kinship Navigator program and you can tell them how it works and really share those stories that make such a huge difference in all policy making. And know that we at Generations United are available to provide technical assistance and help in any way we can. And please ask questions. And by that we mean we and no one else, you know, there are always so many questions with new federal laws that no one really has the answer to. So keep the good questions coming, and we will develop frequently asked questions. It will help inform our technical assistance. It will just help this process along. So what are some resources where you can learn more about all of this? Because it is mammoth. Grandfamilies.org, as I'm sure many of you are aware, is a collaboration we have with the American Bar Association and KC Family Programs. It is a one-stop shop for kinship. We have all kinds of resources on there, including state fact sheets for each state, and we will be posting the slides and the recording from today to this website, and we will give you that link on the next slide. So Generations United's also got a brief summary, just a 2-pager on the implications and kind of a summary of what we talked about today, and you can get that on the GU website or the grandfamilies.org website. We have the Model Family Foster Home Licensing Standards available there at grandfamilies.org or at the NARA licensing website. And then the WikiHow, which we did in collaboration with the ABA and Child Focus, is also available at grandfamilies.org. Or if you want it in the editable, I can't pronounce that word, but in a format in which you can edit, you can go to wikihow.com, and it is there as well. Children's Defense Fund has a number of very thorough, thoughtful resources, which you can access at that link, including that timeline I mentioned, and a description of all the provisions. And then KC Family Programs are developing a number of tools, including a catalog of prevention services, of evidence-based prevention services, and then another document with the costs of those services. So very useful tools. You'll see their handouts to this webinar. So you should see them on your right-hand pane, and you can click down and save those to your hard drive. And those are helpful tools. They're not finalized yet, so when they are, we will also have those at grandfamilies.org. And then finally, the webinar slides, the recording, all of that will be at that link specifically, and we will send that out to you in an email as well, so you don't have to remember necessarily exactly where it will be. And then finally, I'm going to turn this over to Adam Otto to facilitate any questions that you may have. And this is my contact information and Jaia's contact information. We encourage you to reach out to us. We're happy to help in any way. If we don't have the answers, we will try to find the answers. Thank you all for joining us today. Adam?
All right, thank you so much, Ana. So I think we're going to start with a question for you, actually. Someone just wanted some clarification on what we mean by a family foster home. They asked, is this a specific kind of home or kinship family situation?
Oh, thank you. Yes, by that we mean it's a home where no more than 6 foster children are in it, so it's not a group setting. It is, when I use it, I mean all foster families, so kinship foster families and non-related foster families. So, you know, the typical, what you think of. It's not therapeutic foster care. It's not group settings. It's just that kind of traditional foster setting in a home with either a kin or a non-kin.
Thank you. A question for Jaia. What will kinship navigators provide? Sort of a broad question, but
like what types of services, I assume. So I did mention that the law actually refers back to the kinship navigator programs as they're described in the Fostering Connections to Success and Increasing Adoptions Act of 2008. So you can look there for details, but broadly, we're talking about information and referral. It calls on the programs to coordinate with a 211 service if that is available. They need to have a toll-free number and website that is updated with information as it is developed. It also needs to connect families to any kinship-specific programs in the community, information about benefits at the federal, state, and local level that they would qualify for, any information about relevant training for them, any information about legal assistance information, and then there's sort of a big other services category, other relevant services for the families. And then the programs also are to be promoting partnerships with schools and private agencies and other systems that would serve the families. So broadly, that's what kinship navigators are.
All right, thank you. So I think this question is for you, Ana. States, and Jaia can chime in as well, states applying for prevention services, do they need to meet the model standards to qualify for those, or can they not meet that requirement and still get prevention services?
In terms of the model licensing standards, those are separate requirements. So they don't have them connected in any way. But I hope that was the question. Do you have anything to add?
I think so, that those are two different parts of the bill. So states can decide to provide the prevention services and include them in their state plans, but that's an independent decision from the model standards. The model standards is a mandatory requirement, so all states have to measure their standards against the model standards and report back to DHS. So that's the requirement, whereas the prevention standards or the prevention services, they can decide to offer them and put that in their state plans.
All right, so another question for you, Ana, and this is just sort of a little more clarification on the family foster home bit. Is the definition of a family foster home of no more than 6 foster children a new provision that was in the Family First Prevention Services Act?
That's a good question, yes. Before, the feds didn't say anything about capacity standards, and it is in there that it's no more than 6. And I think it's just because they're trying to, distinguish it from group care. But before, there was no number attached to that. But 6 is the number in our model standards as well. So if you adopt the model, you will be in compliance with that. Thank
you, Ana.
Sure.
So this question is for Jaia. If the Kinship Navigator-like program also includes a support group that has an evidence base, can that program be reimbursed for prevention services as well as navigation services?
So if you live in a state that opts to include prevention services in their state plan, and your support group is an evidence-based program that demonstrates positive impact on mental health, then potentially, yes, if you had a contract with the state, then that program could receive federal reimbursement if it met all of those requirements. And then if you were also providing kinship navigation services, you would separately, if you have a contract with the state, be able to get reimbursement through the state through kinship navigation services as well. So those would be 2 opportunities in 2 different parts of the law if you have a relationship with the state to get federal reimbursement.
Thank you, Jaia. So I have another question for you. We know that states are able to opt in to prevention services, but the rest of the Act such as the QRTP and group care provisions, are not optional. Is this correct?
So the prevention services, again, are available if the state opts to include them in their state plan. The other provisions of the Act, it depends on the provision, because it's a big Act. Because you specifically asked about the QRTP provisions, I will respond to that. When we talk about QRTP, we're talking about quality residential treatment programs, so a congregate care setting. Those provisions are ultimately mandatory for all states. However, states can delay implementation of that provision for up to 2 years. If they opt to delay implementation of the QRT provision, they cannot then draw down or include the prevention services in their state plan until they begin also implementing the QRTP provisions. So if you're delaying the congregate care, you also have to delay the prevention services.
All right, thank you. We have another question, and let's start with Ana, and then if Jaia wants to chime in. Who will determine if a child is a candidate for foster care?
I'd like Jaia to chime in on this, but that would be an agency decision. Would it not, Jaia?
That's correct. So the child will come to the attention of the child welfare agency, and there will be an assessment at that point about whether or not they're at imminent risk of coming into foster care, and then if they would qualify for the prevention services if they're available to be offered. So that would be a decision of the child welfare agency, who then puts together the prevention plan if they determine that they qualify for prevention services. Yes, and It's important to identify that we are expecting some guidance from HHS. We don't know for sure what all will be included in the guidance, but some of these kinds of questions that come out often can be addressed in guidance.
All right, so thank you. This question is for Jaia. When will the congregate care federal funding restrictions be imposed? So, for example, if a state chooses to delay prevention services to 2021, then does congregate care cuts delayed until 2021? Or
okay, I think that I answered that question before, but again, the congregate care provisions are required for all states. However, states can elect to delay them 2 years. They can then begin the prevention services after they have begun implementing the congregate care provisions. They could not begin the prevention services until the congregate care provisions are also implemented, and they can only delay them up to 2 years.
But after that 2 years, if they elect not to, they still do not have to do prevention services.
That's true. Prevention services continue to be optional, but very important for our families. So we, of course, hope that they are used. Is there another question?
Adam, may I add a clarifying? I just want to add something about the capacity standard question and the 6, and let people know too that prior to this year, our model had said 5 foster children, and that was based on a careful review, but we extended it to 6 recently. But if a state has a capacity standard of 5, that's not going to be a problem. The only problem would be as if it's more than 6. That helps. I just wanted to clarify that, sure. And of course, there is exceptions for keeping siblings together. That really is very important both to the feds and to the states. So.
We also got a question about what happens to the funding formulas if states are delaying prevention services because of delaying the congregate care implementation. The funding formula situation would be the same. They still have to meet certain requirements. There's the 50% reimbursement up until 2026, and then after 2026, there's the increased reimbursement. I believe that that would remain the same. It doesn't get delayed, I believe, but I will say that that's a good question, and I will seek clarification on that.
Right. So I think that's about all the time that we have for questions. Thank you so much, folks, for sending them in.
Great. Yes, so thank you again for joining us on the webinar. I want to acknowledge that this webinar was absolutely at capacity, so you are the folks that were able to make it into it. As we mentioned, the slides are going to be available at grandfamilies.org. We will also send you a link following this webinar to direct you where to get this information. So if you know somebody that wasn't able to get on the webinar and is interested, we hope that you will share that information with them, but they should also get it via a link because they registered for this webinar. So again, we're here as a resource. Please stay in touch with your questions. Thanks for your interest, and go out there and advocate for kinship families. So thank you, everyone.
Yes, thank you.
And we did get away very question, just to be really explicit. You can definitely email your questions that we didn't get a chance to answer to us directly.
Thank you. If you didn't get a chance, please email us.
Yeah.
Thank you so much.
Thanks.
Bye-bye.
Bye.